Hi, I'm Zach. I'm a student physical therapist. I'm going to be talking about pain. So most people, when they think of pain, think of that acute injury. Let's say you stub your toe and you immediately feel pain in that toe, and it's helping prevent you from further injury to that area, and in that way it's adaptive. But an important thing to think about with pain is that it's not necessarily directly correlated to tissue damage. So you can have tissue damage and pain. You could have tissue damage with no pain, and you could even have pain with no tissue damage at all. So, in that way of thinking about it, it's really more about the brain's perceived threat that elicits pain. So, it's a perception. And a good analogy to think about that is to think about a tack that you step on. Let's say you're in your house and you're in your kitchen, you step on a tack. Immediately, there's no other source of threat, just that pin that's in your foot, and therefore you get that stimulation that the pin's there, and then your brain interprets, oh, we should be in pain right now, and you experience that. But let's say, same scenario, you step on a tack again, but this time you're outside and you're running from a lion. The perceived threat of the lion is much greater than that of the tack that's in your foot. And therefore, although your brain is getting that information that there's a tack in your foot, it's not going to be eliciting any pain because it's much more concerned about the line. Once you get away from that line, you then might be like, oh, I have something in my foot, and then experience the pain. So you can see there how it's not necessarily indicating always that there was tissue damage. And to kind of think about that further, you can think about too the context and how important that is to experiencing pain. So, for example, there's a guitarist, they injure their finger, their job depends on their ability to use that finger, and therefore they're going to experience that pain pretty intensely, versus a runner who doesn't necessarily need that finger. Same injury, they're going to experience a lot less pain because it doesn't depend on their job anywhere near as much. It's not as threatening. So that perception of threat is kind of crucial to how pain can become maladaptive as well. So one of the biggest things that can make pain long-lasting, longer than the tissue damage that occurs, could be stress. Stress and pain are best friends. They go hand in hand. The more stressed you are, the more it's going to affect kind of that pain threshold and how sensitized you are to pain. And that's one of the ways in which it can become maladaptive. Your injury's over, there's no longer any tissue damage, and yet you're still experiencing significant pain. So it's not that the pain you're experiencing isn't real. It's very real. It's just that it's dependent on other factors besides just that tissue damage. So, for example, if you have significant marital stress, you lost your job, anything like that, those types of things are very important to consider along with that pain because they could be heightening it. The good news, though, is that this is reversible. You can desensitize yourself to that pain, and one of the best ways to start is literally just to know more about pain. And so that's what we're doing here. The more you can kind of understand it, the less you're going to be catastrophizing about it. And already that's going to help kind of reduce some of that pain. But what we're going to be doing together with our physical therapy, we're going to do all sorts of interventions like graded exercise. And those types of things are also going to help desensitize you to that pain and help improve. So we're just going to get started. And I hope that helped a lot. And we're going to get going today.